How does Medicare Advantage compare to Original Medicare? Imagine having two ways to get your health coverage through Medicare. One is traditional, called Original Medicare, and the other is a more bundled plan known as Medicare Advantage. Both are approved by the government but work quite differently. Original Medicare includes Part A, which covers hospital stays, and Part B, which covers doctor visits and outpatient services. You can see any doctor or hospital that accepts Medicare, giving you broad access across the country. However, it doesn't usually cover routine vision, dental, or hearing care. If you want prescription drug coverage, you need to buy a separate plan called Part D. With Original Medicare, you pay a monthly premium for Part B, and there are deductibles and coinsurance for services. There's no cap on how much you might spend out of pocket each year, which can be a concern if you need a lot of care. Many people buy supplemental insurance called Medigap to help cover these costs. Medicare Advantage plans, also known as Part C, are offered by private insurance companies approved by Medicare. These plans bundle Part A, Part B, and often Part D into one package. They usually include extra benefits like vision, hearing, dental, and sometimes wellness programs, which Original Medicare doesn't cover. Many Medicare Advantage plans have low or zero monthly premiums beyond your Part B premium. They also set an annual maximum out-of-pocket limit, which for 2025 is up to $9,350. Once you reach this limit, the plan covers all your approved services for the rest of the year. However, these plans often requiring you to use a network of providers and may need referrals or prior approval for certain services. This can limit your choice of doctors compared to Original Medicare. Another difference is how care is managed. Original Medicare doesn't requiring you to choose a primary care doctor or coordinate your care. Many Medicare Advantage plans, especially health maintenance organization types, do requiring you to pick a primary doctor who helps manage your care and referrals. This can be helpful if you have complex health needs. When it comes to traveling outside the United States, Original Medicare generally doesn't cover care abroad, but some Medigap policies might help in emergencies. Medicare Advantage plans usually don't cover international care either, but some may offer limited emergency coverage when traveling. Managing your health coverage is also different. With Original Medicare, you handle separate plans for hospital, medical, and drug coverage, plus any supplemental insurance. This can be more complicated. Medicare Advantage simplifies things by providing an all-in-one plan with a single card and one point of contact, which many find easier to manage. In summary, Medicare Advantage offers a bundled plan with extra benefits and an out-of-pocket spending cap, often at a lower premium. But it may restrict your provider choices and requiring approvals for some services. Original Medicare provides broader access to providers and fewer restrictions but does not have a maximum out-of-pocket limit and requires separate drug and supplemental coverage. Your choice depends on your health needs, whether you prefer more provider flexibility, and how much you want to spend. Always consider consulting with a healthcare professional to find the best fit for your situation.